Morning. I'm Dr. Siva, internal medicine physician. Since all of us are in MCO at the moment, okay, those who are staying at home might have more time to know a bit more on COVID-19. Okay, there's numbers of cases and numbers of death is everywhere in the social media, so I'm not gonna linger on that. But what I think that will be beneficial for public is actually on what are the symptoms, presentations, and who are at risk. Okay, first let's see who can get it. Basically anyone, okay, whatever age range group. However, who are at risk? So those who are first more than 60 years old, those who are having cardiovascular disease, those who have diabetes, chronic respiratory diseases such as COPD or asthma, immunocompromised status, okay, it can be even due to diabetes or any other chronic diseases, obesity with BMI more than 35, and chronic kidney disease. These are tabulated risk factors based on reports from China. Okay, so anyone who is falling under these groups of risks have to be extra vigilant so that they don't get COVID easier. Okay, number two is the symptoms. Okay, I think this will take a bit of time to explain. Okay, COVID disease actually spans incubation phase can span up from 3 to 14 days. That's the reason why MCO was given 14 days. However, I will be talking a bit more on the phases of the disease. Okay, so phase 1, which is called sometimes asymptomatic phase, that can run 3 to 14 days with median average of 5 days. If the patient has illness, they show up some symptoms. Okay, it is also known as the incubation phase. The symptoms is still the 4 major symptoms, which is fever, cough, some what a body aches or general feel of unwellness. However, there are patients who do not feel any of this. They are the asymptomatic group. Then there is another phase called phase 2, which is also still overlaps with the phase 1, which is febrile phase. Generally, it comes within the day 1 to day 7. Okay, this is febrile phase where patients generally have fever. Phase 3, this is the it starts to go into what we call as the critical phase, which is day 8 to day 10, and usually lung invasion of the coronavirus happens, where patients do present with symptoms such as pneumonia, shortness of breath is not really yet, but they mainly present with cough and some pneumonia pictures. Okay, then phase 4 is where it's between day 10 to day 12, where here the cough gets worse and some patients starts to have exertional dyspnea. Or what does that mean is that when they walk stairs or they when go simple activities like going to the toilet, they feel breathless. So this is the phase where you call pneumonia with hypoxia. And phase 5, if they don't recover, they go into what we call cardiogenic shock, where the vitals starts to crash, and this is the place that major of the patient succumbs. All right, so to simplify, there's 5 phases. Not everybody goes up to the 5th phase. Some people just walk through the first 2 phases and then become better. But if you have risk factors, you can go into the 4th and the 5th phase. Okay, where most of them needs ICU therapy, ICU coverage, okay, to support ventilation. Okay, that's about the phases. Now we talk about the tests. The tests gold standard are still PCR swab tests, because they are also in market and also in social media. You can see that they are rapid tests and everything. However, the rapid test uses antibody tests, and antibodies to be created in your body takes time. Thus, it's not an effective screening test. Okay, the swab test is still is the most applicable at the time moment. Okay, now we go for treatment of COVID. for the asymptomatic patients are mainly symptomatic treatment. They do not get any hi-fi drugs and whatever not. However, those patients with symptoms, especially when they go into the phase 3, they receive anti-HIV medication like Caletra, okay, as well as anti-malarial drug, which is hydroxychloroquine at the moment. However, this is also added with many other medications as per needed, and more evidence is coming daily. So the ID team as well as the personnel who are treating COVID-19 infections use these guidelines as it is keep changing at the moment to treat the patients. However, no matter what of this, the best approach is still prevention, despite we are going into late decontainment, going into mitigation phase. Okay, because if you can prevent this, you do not need to think the rest of it at all. Okay, so stay at home, make minimal contact with outsiders, including the Grab drivers or people who are sending you food. Try to use contactless delivery, okay, and stay safe. Thank you.